Hi, welcome to Vaughn Inlet's YouTube channel. The topic of today is lateral pelvic tilt, which can cause hip or low back pain. We're going to go through an assessment, some postural correction, and some strength training exercises to help you get neutral. Check it out. We saw this assessment in the last video, but if you get into this stance and you did have an elevated pelvis on one side versus the other, then this would be the correct video for you. But the strength training and stretching recommendations in this video would be indicated for you either way. But let's assume you have a left elevated pelvis when your legs are wide. Now in that case, you may be standing like this a lot, and what's happening is that the femur is essentially driving up into the acetabulum higher than the leg that you're really not standing or putting much pressure on. So for example, if in that last video you're standing on your right side, that'll make your right side actually shorter, which can give your left side an elevation over that right side. So despite in that stance before where it looks like, oh, my left side is lower than my right side, if you're standing like that, if you stand like that for long periods of time, actually your left side can be elevated because you're not putting any pressure on that. Now to correct this, we can perform a number of options, but one of my favorites is just standing and leaning over a little bit onto the left. It's hard to tell. I probably should have shown my feet in this one. I apologize for not doing that, but I can kind of subtly shift over to that left a little bit while keeping my pelvis level. Now you could just shift completely onto that left pelvis and then the right side will stick out, but the problem with that is that that can still give you an elevated left pelvis, so we're not going to do that. Now this is one where if I had an elevated right pelvis, okay, I'm going to switch gears. What I'm looking to do is, because let's say I had someone who was standing on their left pelvis on the left side a lot, I'm looking to press the right femur now into the socket and then distract or pull away the left femur. As you can see, I'm using a dumbbell. You don't have to use any weight. Now in this video, before we get to the strength training exercises, my left side is on a 10-pound plate, which is about an inch, and I am making sure that my pelvis is level. Now I kind of had to really screw with my belt line to make this level because my left side is actually more elevated than my right side. But this is exactly what we'd want to see. The problem is if I didn't have that plate underneath me, I would have a lateral pelvic tilt and I would be doing deadlifting. That is not ideal. We don't want that. So when you position yourself during any strength training, make sure that you have a level pelvis. Now whenever, let's assume that our right side is elevated compared to our left side, well, those right hip abductors are going to be lengthened and often weakened. So we're going to do a right hip abduction hold or reps where we're holding up top as much as possible. You'll find a lot of people, they'll cramp up, so you want to build that up. I'm also doing a left adduction hold because my left adductors are weakened since the left side is lower, and it places the adductors in a lengthened or weakened position. So I'm holding this position, trying to make sure that I have a level pelvis the whole time. Now we're going into the mobilization and stretching. My foot is on the wall. It might be kind of hard to tell, but it is on the wall. It is fully supported, and I am trying to go for a stretch. Now, as you can see, I'm not getting that much of a stretch, but I would generally encourage you to try to get at least 45 degrees. If you're very flexible, it's still a great way to turn off those adductors. Now in this case, I'm turning off my left hip abductors, which are often going to be tight if I have an elevated right pelvis. So in this case, I'm holding this position, trying to deactivate those left hip abductors. The other thing I can do is try to do a side plank where I'm elevating my left side. This might look like an asymmetrical side plank because it is, because I'm trying to offset or balance out the right elevated pelvis by elevating my left side a little bit more. So you can do some work in which the opposite side is elevated a little bit more when you're correcting it. If you have any questions or comments, please post them below. Thank you.